All right, first of all, the patient says, oh, I start to have some pain on the knee, and the way he said, oh, the pain is like right here. I asked him, where's the pain? And he said, oh, it's right, it's on the left side. So he said, oh, it's right here. He could not pinpoint where the pain is. And the first thing that went through my mind is that usually there's no joint around here, and the only thing that's here is the attachment of the quadriceps, to the patella. So usually it's not number one things that we check. So I asked the patient to lie down. Go ahead and lay down on your back. Okay, can you scoot back a little bit, please? Okay, so the number one thing, most common injury is the meniscus injury. And out of the medial and the lateral meniscus, medial meniscus usually hurts. Have more tendency to get injured. And the worst case scenario is called unhappy triad, which is the medial meniscus, ACL, and also the lateral and the medial collateral ligament. And the most common structure that happen with any kind of sports is this type of injury. If someone hit from the outside, attack, or hit right here, or fell from a snow ski, and it's very common to have this kind of injury. So this ligament, collateral ligament, get pulled and even tear, and meniscus, medial meniscus, and also the ACL because of the twisting force. So number one test that we can find is the McMurray test. And the patient is better in supine position, and we can flex the knee to 30-degree flexion and bring it to extension. During this time, we're gonna apply a little bit of rotation force. So if we are checking the medial meniscus, we roll the knee kind of internally, like this way. And if there is patient kind of grimace or having pain, that's positive. And for our patient earlier, I even feel a click right there. And if we're checking the lateral meniscus, we roll it to the other way, and then kind of go from 30-degree to fully extension. If patient has pain, then that's positive. All right. After that, we can check the posterior drawer test. That's for PCL, posterior cruciate ligament. And anterior drawer test, that's for ACL, anterior cruciate ligament. And then we can put both thumb right here on the joint line, and then kind of like pull it forward to see if you feel this kind of displacement. If it's broken or torn, then you can feel a lot of displacement. Ironically, they should not be having too much pain because it's a complete tear. If it's like half tear, then patient can feel like kind of weird sensation and sometimes pain. But a lot of times patient don't even feel it, but you can feel like, whoa, it's coming out a lot. Yeah, so that's a complete tear. So the next one, I want to check if the patient says like severe pain in the joint line here, and then I wanted to kind of find out if there is more injury. Then I'll do the medial collateral ligament and the lateral collateral ligament stress test. Again, it's not fully extend, it's not 90-degree, it's about 10 to 15 degree of flexion. And I can do this kind of valgus stress to see if it's medial collateral ligament, check the integrity of the ligament, and to check the lateral collateral ligament, then I do the varus kind of stress. So there we go. We have the anterior, posterior, valgus test, varus test, McMurray on the medial, and McMurray on the lateral. And that covers the majority, the most common injuries. And also we can put the knee in about, I won't do full extension, but I'll go a little bit like 5 to 10 degree of flexion. There I can check the patella to see the glide. So the patella should be able to glide freely upward, superiorly, inferiorly, medially, laterally, and also the tilt this way. They should glide very quickly. If I wanted to see if the pain coming from the joint between the patella and the femur, then I can do the prehension test. So I'll have the patient go ahead and sit up for me, please. I'm gonna show patient what I about to test, and I'll let the patient to extend the knee like a long arc quads like this. And then I go ahead and bring it down and apply pressure onto the patella towards the femur. So I'm gonna apply pressure right here and go ahead and extend your knee and go down slowly. Do about 2-3 times. If it's damaged, then you feel the crepitus, which is like the grinding, and sometimes you can hear it too. So that's positive chondromalacia, and that can happen to athletes who are on their feet a lot, or dancer who dance a lot. Yeah, basketball player, I used to have those too. Yeah, and therapy-wise, we just help strengthen the VMOs and help with the integrity and stability of the knee. Things to avoid is to go downstairs with the alternate steps. Do one step at a time. Go down with the bed leg first, and one step at a time. Just take it easy. After it's healed, they will be able to go down faster. But for now, try not to aggravate the issues by going alternate or doing the eccentric type of movement to when someone goes downstairs or go down heels. All right, good job, guys.